Bloemfontein-based doctor has made headlines for accepting only what patients can afford for a consultation. Now, Coyne Healthcare, a South African health company, is supporting Dr. Paulo Valdelori's philosophy of helping others, particularly disadvantaged pregnant women and infants who are most susceptible to malnutrition and illness, by donating vitamin D supplements to them. Malnutrition affects 1 in 4 South African children and was one of the biggest contributors to childhood illness and death. For more on this, we joined via Skype by Coyne Healthcare CEO Kevin Coyne. Mr. Coyne, a very good morning and a warm welcome to Morning Live.
Morning, and morning to you, all of the listeners from Dublin and Ireland. I'm here this morning, so it's still quite dark, early in the morning, so good morning to everybody.
Well, great stuff. First of all, tell us about Dr. Paulo's unique service and how you're supporting him.
I came to meet Dr. Paulo Valdelori several years ago at his practice in Bryanston. I was immediately drawn to his genuine care for his patients, his sincerity and his desire to help people. He left that practice and has restarted this initiative in Bloemfontein. And when I came to learn of it, just simply wanted to get involved. The nature of our company is to serve and help people, and this is both our hearts as a company and philosophy. So given the opportunity, we immediately wanted to get behind him, and so we take the opportunity and the quick.
I mean, Mr. Coyne, why is it important for you to support Dr. Paulo in the way that you are? I mean, this kind of service couldn't have come at a better time in South Africa because healthcare is an absolute must, and most South Africans cannot afford proper healthcare.
I think it speaks to the philosophy of our company. We didn't start the company with the intention of becoming this huge multinational business that was profit-driven. We really started the business with the intention to serve people, and we're now in a position to do that. And this group is vulnerable, and we have access to these products, and it's supported by other people who have means. So essentially, if we can support these patients with these nutritional supplements, and what may be seen to be generous is really close to our heart and needed. So this is why we've done it.
So is this a once-off service, or are you also looking into exploring an ongoing relationship and collaboration with Dr. Valdelori?
No, absolutely. I think for us, it's the start of a long journey with him, and this is why we've got behind the initiative. We want to see where it takes us and where it takes him. And certainly he'll receive our support on an ongoing basis. So no, it's not a once-off, but it's something that I think is the start of one journey where we get to serve hundreds of thousands of South African patients.
So has the distribution started it? How many people are you targeting?
Look, it is important to remember that a lot of people think as soon as you're generous that you must be a very, or as soon as you do something that's like a donation, you must be a large company. We're still a relatively small company when we look at our counterparts. The business was only started in 2013, and before you can become generous, you have to become successful and you have to become profitable. So started off with 1,000 patients, and this is where we've begun, and we think that's a great start. With these 1,000 patients, the ripple effect, and really we feel by investing in these people. This is our community, and it's an investment into our community. And if we can uplift that community, it's good for all South Africans.
Mr. Coyne, I mean, you are starting out in one province, and we know how much of a big deal malnutrition is. So any plans of taking it across the country?
Well, our company is represented across the country. And in fact, that's why I'm in Ireland at the moment, because we now represented here. We've started with Paulo because he's a unique individual. Essentially you need people that can serve. We play a part in this. We have the tools and we have the accessibility that can, products that can assist these patients. But Paulo is really the driving force of it. Without Paulo, Dr. Valdelori, essentially we can't serve these patients. So we've started in Bloemfontein based on him. And if other doctors want to start similar initiatives, or there's other opportunities to do something similar, and we have the means to do so, it's certainly something we would like to take to other communities.
So other doctors, other medical practitioners and those in the medical fraternity in general watching this interview and, they have some sort of interest in helping out their communities, how do they get in touch with you?
Look, we're easily accessible. We deal with doctors around the country. We probably have around about 500 practitioners which are actively involved with our company. It's important to understand that we're not a charity. There's a limitation to how much we can do, but we're doing as much as we possibly can. And so we would welcome people to contact us with good initiatives, especially with patients really need help, and when we are able to do so, we would love to do that. And they can contact us through our website. We're Cape Town based.
All right. Thank you so much for your time. Much appreciated, Mr. Coyne. And now, half of South Africans may be deficient in vitamin D, which may contribute to malnutrition or poor health. A South African health company committed to helping fight malnutrition amongst women and children by donating vitamin D to its patients. We just spoke to the CEO, Kevin Coyne.